All right, in today's episode, we talk about how functional practice can improve your health and what women need to know about the small details we tend to neglect. So I'm incredibly excited to have our third episode feature Miss Melissa Rivard. Melissa originally joined Perform on our 21-day challenge as a potential member back in February, and I still remember that you being in class, and I immediately remember saying, there's more that I need to know about this woman. And instantly kind of she had this aura around her that was contagious, and we knew that, there was potential for her to be working with the Perform team. And so we kind of had conversations regarding her background and what you were looking to achieve. And that's what kind of brought us into the conversation of you being on our coaching staff. Now, in terms of Melissa, she's currently attending school to receive her bachelor's degree of natural medicine, which she already has one bachelor's degree of psychology as well as a postgraduate teaching diploma. She holds her CrossFit Level 1, her NASM personal training, Ashtanga yoga, yoga and Chinese medicine cert, spin cert, first aid, all sorts. Melissa has taught around the world from New Zealand to Ireland, Germany, back to New Zealand, Hong Kong. You did some teaching here as well. You're now working at IMI, which is Hong Kong's largest natural and integrated medicine clinic, which is Integrated Medicine Institute. Yes. Melissa is passionate about building and being part of a community that aims to educate and empower people to make healthy lifestyle choices in order to achieve sustainable, holistic well-being. When training, having integrity with movement patterns which support individual needs in order to promote the growth and prevent injury is an important value of hers. So, that is all about Melissa.
Wow.
Welcome.
Thank you.
So, walk us through how you got into this natural medicine and kind of got you on the path to wanting to study it from a as going back to get your bachelor's. Okay. Another one.
Oh, yeah. Well, first, thank you so much for having me. It's a real privilege to be here. And it's been an amazing journey becoming part of this community, and I'm really appreciative of that. So I guess it gives, that bio also gives away my age, obviously. So this has been a long journey and not something that has happened, in a couple of years. And it's a continuing evolution, I guess, for me. And I guess the training and the sports side of things is always something that has been part of my life. And as I got older, I guess what started to happen was I started to get injured, and I wasn't recovering as well as I should have been. And I was working at the time in Munich as a personal trainer with a mentor who was also a functional nutritionist. Okay. And he kind of said, something's going on here that is not making sense given your diet. And long story short, we kind of unveiled this autoimmune issue that I have.
And what year was that?
This was in 2011, 2012.
Okay.
Yeah. And prior to that, once I unveiled it, it kind of made sense, all these other issues that were happening, with getting sick or not recovering fast enough with my injuries.
So can you tell the listeners what an autoimmune disease is?
Yes. Okay. So an autoimmune disease is basically a dysregulation of your immune system, where your immune system becomes hypersensitive and it starts to attack your own tissue. So it is usually, the etiology or the cause of this is usually a combination of genetic predisposition as well as a trigger. So the trigger could be an infection, it can be trauma, physical trauma, it can be an injury, it can be stress, emotional stress. And what tends to happen is the body will be attacking something that's foreign in your body, but then it it starts to, whatever is foreign, closely will mimic something else that isn't foreign in your body, and it then attacks your tissue. And it usually leads to chronic inflammation, and it's insidious, like it's something that isn't picked up right away. You might have things happening that are symptoms of other issues, and so it's really hard to pick up for people, and it's often picked up when it's really far along in progression. For me specifically, it was my thyroid.
Okay. And was it a genetic or was it a trigger for you?
It was probably both. I do have a few genetic polymorphisms that predispose me. It runs my family, so I have family history of autoimmune conditions, so I should have known better that it was there.
But did your family members know that they had this prior?
No.
Okay,
no,
got it.
No, it's all been it's all been unveiled probably around the same time.
Okay.
My sister has an autoimmune condition. It manifests totally different than mine. And maybe at the time, I was training too much, so it could have been overtraining. When I was young, in my early 20s, probably not eating properly. So this is why I'm so passionate about the work that I'm doing, because the prevention is so key. And everyone is at risk, for developing potential inflammatory conditions. Likely, you don't have to go get a genetic report. Chronic disease is becoming more and more prevalent.
So in your case, so you're working with this coach in Munich, and you realize, something is off. It's irregular. You find out that you have an autoimmune disease, and it's triggered by your thyroid. What were kind of the symptoms that you guys saw that made you say, aha, that's not normal, or this is not normal for an individual who is following everything from your training, diet, nutrition?
Yeah. I was really tired, so apart from my training, so I would train and I'd have this energy boost, and then I would crash. So I would be really tired. I thought I was just maybe burnt out or from work. I had one specific. I jumped onto this retaining wall and slipped, and got some stitches in my leg, and it just didn't heal. So I had the doctor saying, this is not normal, that 5 stitches isn't healing in your body. It should repair. And I was having a reoccurring infection. Again, it just wasn't. The basics were there, but which is really important. We'll talk about later. So it was definitely something that was underlying that I had to sort out. And once I went and got my bloods done, it was very obvious what was going on.
Okay.
Yeah.
So you recognized something was wrong. You went and had blood tests. Now, these aren't the normal blood tests I'm assuming that people have during their general checkups, or is it a specific blood test?
In this case, it was actually, and so I did go and see a GP, and so I had a full thyroid panel done, homocysteine and C-reactive protein. These are all things that your GP can do. Okay. And if there are flags for autoimmune, then that's something they should be testing for. That's not something you have to see a functional practitioner for. Sometimes, though, they might not, and that's why it's important to work to find a good doctor. When I got those results back, the GP was fully on board. So I was lucky that I had someone who was willing to do a little bit more work.
So what happened when you got the results? Kind of what were the next steps? What did you guys discuss?
Well,
that's about 8 years ago now.
Yeah. So the next steps were, from the doctor's perspective, was to go on thyroxine.
Okay.
And so I am on thyroxine now, but it took me a little while to get to it, because when I was working with the functional nutritionist, that's where the GP sort of stopped. They were like, okay, you need to go on thyroxine, and that's going to solve everything.
And that's solving it by increasing?
It decreases your TSH by increasing your T3.
Okay.
But your teeth, it gets complicated because when these hormones you're taking, they're often not in their active form, meaning the form that your body actually needs to do the work to feel better. And so if there's an issue of converting into the active form, which for many people with thyroid issues, that is the issue, amongst other things, then you can be taking this thyroxine, it can drop your TSH, which is what they're measuring, but you can still feel like crap.
Okay.
And so there are a few people here I know, like Hashimoto's is an autoimmune condition of the thyroid, and it specifically attacks the thyroid tissue, and taking thyroxine isn't actually fixing the immune
It's
issue.
only creating a baseline for the specific test that they're testing.
That's
which is
right.
The TCA.
Yeah.
Okay.
And so it's really just about finding the root cause, and for me, that's where this now journey has been in terms of study and working with different doctors, is for me personally has been biohacking and finding ways that I can pull down that inflammation and manage, because having an autoimmune condition, it can actually kind of go into a remission, meaning you're not in that hypersensitive, highly inflamed state.
So so since the GP said, all right, I want you to take this medication, has it always been the same dosage, or have you been able to decrease it? Because I feel like a lot of times now, and I can speak from the US, is the first thing that a GP wants to do is, all right, here's the pills, take them, you're going to be on it for, whether the rest of your life or until we see something decrease, rather than putting into a plan of, all right, this is what you need right now to try to regulate it, but moving forward, there are ways for us to regulate it from a homeopathic standpoint or a natural medicine type of way.
Yeah, I mean, obviously it really depends on the individual, and I'm not a qualified medical practitioner to give this kind of advice. However, I will say on my own experience, and also just from what I see in my study and what I see at the clinic, is that it really does depend on an individual. And even though I study natural medicine, I also have a lot of respect for allopathic medicine. And so I guess for me, it's not just working in silos, and it is this integrated approach which is so important, because both have a role to play. But to answer your question specifically, my doses, I've been able to maintain my dose, which and often the case, people will increase over the years. And I know that my dosage has been low because of everything else I do. I don't know, maybe I'll go off it one day. I'm working with doctors, but there's very little risk for this medication. So I'm also, not going to necessarily. For some people, like for me, it took me a couple of years to go on it. I had to do a lot of research and make sure that it was right for me and make sure there were no risks for me personally. But since going on it, it has also changed my life. Like I've been so much healthier for taking it. So whilst my role, I want to participate in the natural health aspect of medicine, I still, I have friends that are doctors. I have a lot of respect for doctors, and I think that that's where that integrated approach is so great, because everyone has something to offer, and working together is going to hopefully prevent people from taking more than they need in some cases, but also it's about being informed and having a holistic approach. Yeah.
So is this why, you having this autoimmune disease, is that what got you into going back to school?
Maybe. I mean, it's something I always did want to do, but it probably is what it's what really lit the switch for me. It was always in the back of my head that I wanted to go back into medicine, but I think definitely not just my own health, it was more my family, probably my family, my close friends. I was seeing this come up over and over and over again, and people not being supported properly. And so that's really what catalyzed me going and getting, my shit together to do it, basically.
So what happens after you graduate?
Okay, so I'll be a naturopath, and I guess my goal would be to work in a context very similar to IMI, where IMI is they work collaboratively. There are specialists that have, different expertise, but I love seeing GPs, like Western medicine doctors, and these naturopaths and osteopaths and homeopaths all work together and respect each other. And so that would be the dream, is to work in a collaborative context. Yeah.
Okay.
Yeah.
Now you
What's that?
where would you like to practice this?
Well, yeah, we have my husband and I have been traveling a lot over the last 15 years, so we both have had jobs that move us around a lot. My profession has been for the last 15 years in teaching, so and my husband works for the consulate, and so it could be in New Zealand. That would be great, but equally so, it's likely that we'll probably get put somewhere else. And so I'm hoping again that I can work anywhere, really. I mean, and just whether even online, but just, there are these integrated approaches are popping up all over the world. So I'm pretty confident that I'll find somewhere to be mentored.
So what about here in Hong Kong? So you work at IMI. Is there anything that you see specific to Hong Kong that pops up quite often?
Yes, definitely. I mean, what we probably see the most at IMI, in terms of nutrients and deficiencies, the most common ones that we see coming up is like vitamin D is massive, so we can go on that a little bit later in terms of the micronutrients. But in terms of general health, the things that come up a lot in Hong Kong, or at least at the clinic, and remember our demographic is, it's professionals, so it's a specific demographic, but it's typically stress-related issues. Cardiovascular stuff is pretty big. Anxiety and insomnia have been really big, especially in the last 6 months, and we know that those are risk factors for other chronic disease, so they have to be, taken seriously. There's a lot of dysbiosis of the gut. We see a lot of that, where people are not absorbing things properly, or they have like a toxic overload, and a not very diverse microbiome, or too diverse. So that tends to be, again, that underlies so many other issues,
But everything that you were just talking about, from insomnia to stress related, everything is connected within our body.
Totally.
And if we're not, if we're not resetting our body at night when we're sleeping, and we're high stress, then that is the first thing that's going to do, is it's going to affect.
Yeah, it's so true. And I think this is why, look, and I really empathize, like when you start on this journey, especially if you have a predisposition or you are dealing with a chronic disease, it's a really exhausting road, because it is something you have to think about all the time. And as you said, because every system is so interconnected in a bi-directional way, you have these knock-on effects. What's coming up in one system might have nothing to do with that system. For example, the skin, we see a lot of eczema, a lot of skin issues. It's often connected to the liver and liver toxicity or detoxification issues, or toxic overload, you know, in Hong Kong with pollution, etc. So what's coming up as the clinical manifestation is often, or at least not in isolation, the issue. It's always connected to something else. Yeah. So
a lot of trial and error.
A lot of trial and error, and I guess that's the thing with Western medicine. Whilst I have a lot of respect for Western medicine, where I think they struggle, and it's simply, I think, because they don't have, you know, the time, they're under constrictions, it's the way we set up the system, is how to manage these chronic issues. You know, if you're giving someone something to deal with a symptom, but it's not addressing the underlying issue, then it's never going away. For example, cardiovascular disease is a perfect example. A lot of people will be given a statin to lower their cholesterol. Well, it's not necessarily the cholesterol that's the issue in the first place. If you're dealing with atherosclerosis, for example, which is, you know, super common, and you have plaque buildup, well, they give you a statin to lower your cholesterol, but it's actually the oxidation of the cholesterol that's the issue, not the cholesterol. So you may still have an oxidation issue, and your cholesterol comes down, but other things start happening. And again, look, I'm not in any way advocating for people to come off their statins, because you need to work with your doctor. But the point is, I think that there are a lot of missing pieces, and I think people are there's a disservice that's happening for some of these people. And it's worrying, because the long-term impact of not addressing the issue is a burden on the individual's health, but then, you know, our healthcare system as a whole, it's massive. Interconnection.
Yeah. So I know you touched base on the vitamin D earlier, so kind of let's go into that. So, you know, a lot of times we focus on the macronutrients, so your protein, carbs, fats. You know, when we're talking with talking to our members, or about our members specifically, is majority of them have never had the baseline of what nutrition is. You know, they have these diets that they follow. You and I were just talking about the soy diet, we'd have never heard of before that. But it's just getting them to understand, you know, what your body needs from a macro level. And then you got these micronutrients. And, you know, you'll hear, oh, this kale salad is full of antioxidants, right? But there's also an underlying issue when it comes to deficiencies in these micronutrients. So let's talk about those.
Yeah, okay. So nutrient deficiency, so micronutrients obviously are vitamins and are minerals. And nutritional deficiency is really common in the OECD. I mean, it's obviously very common in developing countries, but it's a lot more common than people realize in developed countries. You know, in Hong Kong alone, the last study they did, I think 2014, so they looked at population study of minerals, and they found that magnesium, there's a really high prevalence of magnesium deficiency, of calcium, potassium, iron, and these are really obviously important, which we'll get into. And
do you think that the deficiency is because the food that we're eating is not local, or we don't have a large mass of variety of food that we're eating?
Yeah, I think it's a lot of, yes, definitely those. And then also, a lot of people are still eating out, so processed foods easy to access. It's cheaper, obviously, for some people who struggle to afford fresh fruit and vegetables. And then also the demand on our body is different in Hong Kong. So we're exposed to more toxins here, so our nutrient needs are different. If you are training a lot, your nutrient needs are different. If you're highly stressed, if you're working in the finance district and you're not sleeping a lot, you're going to be burning through your micronutrients. So I think there are lots of factors that deplete our nutrient status. Also, definitely if you have any chronic insulin resistance, diabetes, obesity, all these things that we're seeing go up in prevalence, they all impact the absorption and metabolism of micronutrients. So if you are someone that has any of these risk factors, then you are going to probably have a deficiency somewhere.
Okay, so you mentioned magnesium, vitamin D.
Yeah. Yes, very important. I think definitely in Hong Kong, vitamin D all around the world, there's more and more research that's come out on vitamin D recently. But if you live in a polar region, vitamin D is always an issue. But if you live in an urban environment, you're more likely to be inside more, and so we don't have the same UV exposure. But equally so, we're more worried about UV exposure with, it's understandable.
Yeah.
But we limit our sun exposure, which in some ways is important, especially for some individuals that are more sensitive to the sun. But we lower our vitamin D status, and vitamin D is so important for so many different things. So this is one that's even going into any doctor, I mean, they know that the likelihood of someone being vitamin D deficient in Hong Kong is pretty high. Also, the pollution blocks it out, so that's a major thing here. Magnesium is another one. Do you want me to go into the why we need the vitamin D? Okay.
I think knowing why we need vitamin D, and I think it's also important for us to talk about, because obviously it's number one priority would always be to receive it from food.
Yes, definitely.
Also knowing that there's just going to be, apart from a nutrient and a mineral standpoint, we're just not going to be able to receive the amount based off of everything that you kind of just said that blocks it.
Yeah.
We won't be able to do, which then that's where supplements come in.
Yeah, exactly. Yeah. And I'll just say, with the supplement thing, you're totally right when you say that food first. And there's lots of reasons for that. And one is that the vitamins and minerals, Google and the internet's a great thing, but what we have a lot of people doing is they're going to look up this one nutrient and they're going to go, oh, this is what the signs and symptoms of deficiencies are, and this is how it works, and then they kind of put it in a silo, and they don't realize that in order for that vitamin to work well, it needs cofactors, and each nutrient works synergistically with other nutrients. And so the best way to access those nutrients is from food, because food contains a variety of nutrients which work together. And vitamin K and you need to have, and it's also with the macros. So if you don't have enough protein, you're not going to metabolize vitamin K very well. But equally so, if you don't have enough vitamin K, you're not going to metabolize protein very well. So everything is, and in a way it makes it more confusing and complex, but people have to appreciate that complexity. And I think because supplements are also not as heavily regulated, it leaves a whole lot of space for different manufacturing practices. And so when people are thinking about supplements, before we go into it, I think I really want to make people aware of how important it is to make sure you need it at all, because more is never better. In fact, sometimes often it's quite harmful. And also supplements, you need to have a good quality supplement. If you're going into, and I'm not going to say any names, but cheaper supplements, if they're not third party tested, no one's regulating how they're manufacturing them.
Which means the dosage that's showing on the serving size may be higher or lower than what it actually is.
Maybe, and it may be a form that's not very bioavailable. There's lots of different forms. Forms that are often less bioavailable are cheaper to make, and so and then there's going to be a lot of fillers in it, So there's going to be a lot of, I would be looking at the ingredients, I would be looking at, is it therapeutic grade, I would be looking at, is it third party tested. Really, really good brands are they're super transparent about their manufacturing process. Not great brands, it's gonna be really hard to find. But even at the clinic, our dispensary manager, before we bring things in, like if it's not obvious, we call the manufacturer in to ask them, do you third party test your products? And this is, it's, the supplement industry is a multi-billion-dollar industry, okay? Like they're making tons of money, and they can make anything sound sexy and cool and like it's going to change your life. And I think because we can go in and buy it, we really need to have a lot of discretion around what we're putting into our body.
I think iHerb is a prime example of that. Is it's so convenient. You can go on, and here in Hong Kong you can order and you can have it within 4 days.
Yeah.
And you go on, and let's say you put in omega-3s. There's 1,000 different variables that you can choose from, not only the brands but also the dosage.
Yeah.
And I think that it's pretty overwhelming for most people, and then they also look at the pricing and saying, okay, well, this one's the cheaper, so I'm going to go with this, not actually looking at and doing their history of looking to see if they're third party tested and how transparent they are.
And it's so overwhelming. There's so many different kinds, and your friends will tell you why you need to take something. Oh my goodness, I started taking this, you need to take it. And so when people come in, it's really important to first of all ascertain whether or not you need something. So we're going to go into the vitamins and minerals that are often deficient. It still doesn't mean that you need it. And so you can use Chronometer. There's lots of it. Like you can find a tool. I can give you a tool that you can put your food in for a day, a few days, and you'll see it's not perfect, but you're going to see where your gaps are.
So what would you recommend for those who are listening now?
I think Chronometer it's free.
It's an app or it's a website?
It's a website.
Okay.
You can we can put it up in the bio or something, the website link. And it's never going to be perfect, but it's pretty good. I use it for my case studies, and you can get a good idea of any really obvious gaps. Okay. If you need to go further and deeper, then you kind of start to look at the bioavailability, and I won't go into that in detail, but some forms in our food are going to be more bioavailable than others. Like we know that with our macronutrients, like protein that's from X is different from protein from Y, but you can get the basics, and you're looking to see, and probably you won't get enough of the ones we'll talk about. Once you see the gap, then the second thing I would recommend is go get it tested. If you're in a position where you can do that, then do it. Go get it tested. You're not going to be able to get all of them tested. It's too hard, and there's issues with testing. It's a snapshot. It's 1 day, but vitamin D is pretty reliable.
Okay.
Your iron status is pretty reliable. Those are ones I definitely check, especially women, for iron. Magnesium, can't really test it because most of the magnesium is stored in your cells, and so what's in your serum, there is a test, but there's not a lot of validity around it. B12, not amazing, but it's still a baseline, so you can definitely get your B12. I would go and just get a full blood workup as well, because even getting your full blood count will give you an indication on nutrient deficiencies. So for example, if your white blood cells are up, you can look at possible zinc deficiency, right? So you can look at some of the other pathological or the pathology tests and kind of get a gauge on what might not be in play. And that's where a functional or an integrated practitioner is going to be maybe more of use. That's not to say, I mean, I'll give you the name also of a GP who practices this way here in Hong Kong. So once you get it tested and you confirm, then you're going to work with your practitioner on whether or not you need to supplement. Some people have dietary restrictions for reasons that are really valid. And so anytime you're restricting any food, there's going to be a risk of a deficiency. And that's just full stop, the answer every time.
Yeah.
Some people are restricting things for allergies, and you know, I don't eat certain things for hypersensitivity, inflammation reasons, but I still have to be mindful of what those foods
would be providing
me.
Okay.
And so, you know, whether it's for whatever reasons people are restricting, it's fine, but you need to know what's missing in that food, and can you make it up somewhere else, and if not, what supplement's going to be best for you. And then when you go to the supplements, you know, you talk about the things we already talked about, you know, what's the best quality and what's the safest. When you're looking at supplements, you know, you have your water-soluble vitamins and your fat-soluble vitamins, and so the fat-soluble vitamins are stored in your body, so they're more dangerous in terms of toxicity because you can't excrete them if you go over. Whereas water soluble, if you hit your upper limit, you might get some digestive, you know, like diarrhea, something, but you'll probably excrete it. B12 you have to be a bit more careful with, though. The B vitamins, they're water soluble, but you need to be a bit more careful with the upper limits. So that's the other thing. If you find a deficiency, you know, some people are like, oh, I'm going to just take all of the
yeah.
I'm gonna go hard, I'm gonna just take heaps of it, and you know, at the very best you're just gonna pay it out and it's a waste of your money anyways. But at the worst you're gonna really damage yourself. You're gonna damage your kidneys, your liver, something's gonna go wrong, and so you really need to talk to someone about dosages that are appropriate for you.
So what about like multivitamins?
Yeah, this is a tricky one.
Because they're basically stating that you can take all the vitamins that you need, one a day being an example, is one a day. This is going to provide you all the vitamins that you need. Now that's assuming that you're not getting those vitamins through food.
Yeah.
And so there could be a chance that either A, you're over the amount that you're taking in, or...
Yeah, it's a tricky one. Again, if you're a healthy person, you probably don't need it. There are some cases, there can be a case that's made for a multivitamin, and you know, like a prenatal vitamin, or even just depending on, you know, where you are in your life stage, if you're over 50, or if you're someone who's having absorption issues, it's not a terrible idea. You know, we do recommend them at IMI. The practitioners there will prescribe them at IMI. But again, it's there's a lot of really shitty multivitamins, and they will cheap out on forms. They'll have sometimes not enough of something that you might need. They sometimes have too much. Often there'll be interactions. You know, a lot of the vitamins and minerals, when you take them together, they cancel each other out because they need the same transporter to get into your body. So when people are like, oh, I need some iron and I need some like magnesium or calcium, it's like they're not, you can't take them together, so it gets really complicated.
Yeah.
If you're thinking about a multivitamin though, and you think maybe you're in a convalescence period, you've had chronic illness, or you've been sick, or you've just had a baby, or there's a reason for you to take it, and you're kind of just low vitality across the board, then I would just say go into a dispensary that you trust and have a chat with one of, you know, even at IMI, our dispensary manager is a qualified nutritionist and naturopath, but there are other places in Hong Kong, you know, have a chat with them. It's yeah, I'm sorry, I can't give you a direct answer because it is debated a lot whether or not it's needed. So
coming from growing up in Canada, did you guys have the Flintstone multivitamins?
I love them. They
tasted great.
So good.
I remember when I was younger, my mom would be like, here's your multivitamin, and I'm like, and then sometimes we would take like 3 or 4, and you really only slept 2.
God, I love them.
I think they're still around.
They are around. Yep, we have some gummy ones. Look, kids are fussy eaters, and I don't have kids, so there are people here. Rashmi, actually, who's a member here, she
also works with you at IMI.
She works with me at IMI.
And she's
studying to be a functional nutritionist.
Yep.
And she's got some really awesome tips for kids. So if there's a member here that is struggling with kids and eating, and I would definitely talk to her, because she's got a lot of gems of knowledge. But kids are fussy eaters. I mean, from teaching, I see that. And so there's a case to be made for the kids that just won't eat food.
It's getting them the vitamins they need and the minerals somehow. And if that means through some sugary, good little piece of candy, essentially, is better than nothing.
Exactly. I mean, I would say probably the Flintstones, even though I love them sick, I would say they're not the best. So there are better ones, and you want to look for one probably that doesn't have a lot of sugar in it. And look at the form. Again, you need a good quality. And so there are brands that are reliable, that follow, the manufacturing process regulation really, really well. The TGA, I mean, Australia has a good one, so that just put themselves under it, and those are brands that I would trust, which I can give you a list of as well if you want.
So it's you kind of have listed here signs and symptoms of deficiencies.
Yes.
So, let's go through those, because what I hear you saying is that obviously if you feel like you have a deficiency, get tested. That's the first thing you should do. One, you could go into the chronometer and kind of get an idea, and then after that, get tested. And testing is always going to be the best.
For sure.
At end result, because you're going to physically be able to see what's going on in your body. But let's say you got someone who, feels like they're okay, but they're seeing some of these symptoms. What do those symptoms look like? Okay.
And let me just be clear, actually, the chronometer, if you're feeling unwell, signs and symptoms, you should go see a practitioner straight away.
Okay.
The chronometer is really for those of us maybe who are training, who are feeling fine, but just want to see, do I get enough of my micronutrients? Am I missing anything? Because some of these deficiencies, a lot of them are, as I said, insidious, and they may not be impacting you now, but in 5 years, you're going to see something. So those people that are feeling okay, but think, actually, I have no idea whether I'm getting a good range of micro, then look, because maybe you're okay, but in 5 years you may feel not great. If you do have any of these deficiency signs and symptoms, then you should go and get tested.
Okay.
So if we look even at vitamin D is gonna, let's say we're getting recurrent infections, we're having, it's underlying, cardiovascular disease, autoimmune stuff, so inflammation not recovering, you're getting, when I say reoccurrence of infection, you're looking at like 3+ infections a year that shouldn't happen. You should, you're susceptible to picking stuff up. You're like, if someone comes to work and they're sick, I get it every time. That kind of thing. It underlies also anemia, so if you're tired, like general signs and symptoms of deficiencies, but again, it can be something else, but usually it's like chronic fatigue, anything inflammatory, skin issues, recurrent infection, prone to injury, like fractures, obviously, unless you're in like some crazy sport.
Yeah.
All the time. Heavy periods. So women are separate, right? And so.
So what is your definition of heavy period?
Heavy periods would be like more than 30 mils of bleeding. If you're like going through tampons or like every hour or so for like more than 7 days. Again, like always talk to your doctor about your period. Okay, like this is something I'm really interested in because actually the research on women is pretty poor, and we women are not given a lot of information. And your period health, a lot of people think how my period is just matters for whether or not I want to have a baby. But actually, your period health is a measure of a lot of other things going on, so including your performance. So to have irregular, people are like, oh, well, I have heaps of pain, but that's normal. It's not normal to have pain in your period, actually. That's not normal. And so bleeding excessively, not bleeding enough, these are all things that we can use to gauge what something going on in our body. And it may be a deficiency, it may be something else, but heavy periods can often mean there's not enough iron.
Well, I also remember you talking about how women are typically not included in on drug experiments because your hormonal imbalance throughout the entire month regulates the testing.
Yeah, that's true. I mean, we've realized more recently, unfortunately, that, I shouldn't say that. It's been around, but it's become more mainstream media that women haven't been properly tested. So there's not as much data. And so when you're being given data on, if someone's like, this is evident, it should be evidence-based, what you're choosing to do with your body, whether it's a diet or medicine. But often, if it's evidence-based, has the evidence been taken from women? And often what's happened in the past is men have been tested, and so we are seeing more women die of drug complications than men, which is often because they're taking too much. So that's of Western medicine, more interactions. Our liver functions differently. We process and metabolize drugs differently, and it's a really big problem. I think we need to push hard on science to be giving us the data that's relevant for us, because it not only does it impact our health, it then impacts society as a whole because it becomes a burden. But it's really unbelievable how little women are researched. And you're right, it's because in the past our hormones have been seen as confounding variables. So they're too hard to control, and therefore, we can't put them in a randomized control study. It's easier to test men. And so it takes a little bit longer, but it is possible, and so we need to really advocate to have better research done on women. But it's true, yeah. But your hormones are really massive, and so your hormonal health is really, really important, and that's something you should be talking about with your doctor. And this includes,
and get tested for that as well.
Yeah, for sure. Yeah. Menopausal women, postmenopausal women, it's also important for them to make sure that they're receiving the right RDI, recommended daily allowance, or that meets their needs, because they have a drop in hormones, which then puts them at risk for other things. We see women are less at risk for certain cardiovascular disease than men at a certain stage of their life, and then we see a switch. Like postmenopausal women suddenly become more at risk, and it's like, well, why is that happening? And although it's still being looked at in research, it's definitely suggested that hormones have a role to play in that. And so also are women that think, well, I don't have periods anymore either. They're at risk for other nutrient deficiencies that are important to look at. Vitamin D is really important at that age, and B12. So it gets very confusing, but it's important.
But from the consumer, it's extremely, because you got advertisements that are pushing their own agenda. You have your doctor that's saying one thing, like you mentioned. A friend recommends, hey, by the way, this is what I take, I recommend you. our members come to the coaches and the staff a lot about what supplements I should be taking, what micronutrients, what I should be eating, what I shouldn't be.
Yeah.
I do think that it can get a little bit too overwhelming or overwhelmed for most people.
Yeah, for sure.
Yeah.
Yeah, I mean.
So I think if we were to give one piece of advice to them, that would be get tested, and then that way you kind of know where you're at, and then wherever you do go, they can give you the suggested.
Yeah, definitely. I mean, the one nutrient that's hard to test that also is really common that I want to mention briefly before we close is magnesium, and that's probably the most relevant for our community because you are more at risk of being deficient if you are training. So athletes, anyone who's training, more than a couple times a week is going to be more at risk for deficiency. And so, and in Hong Kong also just the humidity, and this is a hard one to test for. So whilst vitamin D, iron, B12, easy to test for, get it tested. If you're deficient, deal with it. If you can get it in food, great, but probably vitamin D, I'm going to say probably not. And I would look at getting a supplement through your doctor, D3. But magnesium is one that is definitely a deficiency around the world, and particularly the people that have Western diets. They're going to be like a diet that's excess salt, so excess sodium, but equally so too low in sodium is going to be more deficient. Excess alcohol, caffeine, any stress is going to burn through and remember, stress is like physiological stress, emotional stress. So it's like stress, the way we know it, chronic stress at work, psychological stress, emotional stress. But then if you're not sleeping, that's stress. If you're training a lot, that's stress. If you're exposed to toxins, that's stress. So the physiological stress on the body is going to burn through your magnesium stores. And the deficiencies are, you're at risk for cardiovascular disease, neuromuscular issues. Magnesium is required in over 300 biochemical pathways in your body. And it's a cofactor for heaps of other vitamins, vitamin D. So if you're deficient in it, you're at risk of cellular dysfunction, and cellular dysfunction is what leads to things like, cancer, for example, is when cells start behaving the way they shouldn't. And usually, like, basic symptoms to look for would be like lack of sleep is major, restless leg syndrome, this happens a lot for women, particularly, in our luteal phase. So you'll see, like, I'm not really sleeping that great, maybe like irritability, PMS, so these kinds of things. And if you know that the RDI, like if you get this from like leafy vegetables, whole grains, if you're eating those legumes, if you're eating those nut seeds. So if you have like 100 grams of spinach, you're gonna get 79 milligrams, roughly, right? So you need about 320 milligrams a day. But they say, like, there's studies that show that if you're training a lot, stressed women, you possibly need 20% more than that. Okay, so and just to reiterate, magnesium is the hardest, even if you do get tested for it to. It's really, it's I don't know, I've never seen it being tested before, but I know that some people will. I don't think I could be wrong, so I would need to fact check this, but it's not something that because magnesium is stored in your cells, you can't test it in the serum, blood, urine. So it's a difficult test to get a gauge on your status.
Yeah, okay. Can you have too much magnesium?
Yes, okay. Well, in theory, yes. In reality, it's probably if you're supplementing anything, then you're more at risk for going into a higher threshold. But the upper limits are pretty high, and if you have any of these risk factors for deficiencies, remember you're burning through the magnesium anyways. But there are some forms, I would say that 400 milligrams for someone who's quite active, living in Hong Kong, moderate to high stress, is going to be okay.
And taking that in the form of a supplement on top of what they're eating. Because let's talk members.
Yeah.
If our members are eating healthy, clean, they're getting the variety of foods, and they're taking supplements.
Yeah, so I would say, to start, that would be like a max. Okay, so you got to have a think about how much am I getting through my food, and then can I top it up. I take, for example, if you're working with a practitioner, it's likely they'll put you on a high dose of something if you're having these symptoms. But again, I don't feel comfortable necessarily putting that out there, because you can take, if you're someone who has at risk for any kidney issues, that can be really dangerous, right? And so someone who has any kidney issues, any supplement is going to be a lot. So if you're going to take a high amount of something, of anything, you should talk to your doctor. If you're taking, 250 milligrams, or you're taking on top of your food, is probably safe. But again, I would always just have a chat with someone, your doctor, just double check, because you are putting something into your body, and so you should be thinking about whether or not you need it. I would say though that if you are also taking magnesium, it's really important you have the right form. So magnesium, research shows, there's magnesium, the chelated magnesiums, magnesium bisglycinate, magnesium citrate, magnesium threonate have all been shown to have a higher bioavailability.
Okay.
Cheap magnesium is going to be like magnesium oxide, and that has lower bioavailability. It's going to, but interestingly, sometimes it's prescribed for different reasons. Like it has a laxative effect. So if you take too much magnesium, probably what's going to happen is you're going to get digestive upset and some diarrhea. And some people that take, especially magnesium oxide, that's definitely what's going to happen. Yeah.
Okay.
Yeah.
So in terms of, is there, when we're talking about chronic disease, do controlling the micronutrients assist with that, or at that point it's kind of?
Yeah, depends. I mean, when you say chronic disease, I guess, so atherosclerosis, for example,
Which is,
okay, so atherosclerosis, if you have restricted blood flow through vessels, where you have endothelios, so the cells that make up your vascular system, thicken due to fatty plaques, which is actually oxidized LDLs, and then also you have remodeling, where the muscle part of those of that vessel starts to hypertrophy and grow in. So you get basically narrowing of the vessels, which increases cardiac outputs. Your heart has to work harder. And eventually what can happen is you have what's called like these ischemic events. So when you have restricted blood flow to tissue, you have restricted nutrients and oxygen to tissue. And so what happens is that, again, atherosclerosis, kids as young as 10 have it already happening in their vascular system, but you will not see the clinical manifestations of it until you're 50 plus.
And this would, if they had a cholesterol test, it wouldn't pop up on there? Or it could?
It could, but not necessarily.
Okay.
So if you have it, it's actually, it's not necessarily going to come up in your, And remember, cholesterol, like if you have high cholesterol, that's going to be called like hypercholesteremia or like a dyslipidemia. So you have a imbalance or high, but that's not necessarily a diagnosis of atherosclerosis.
Okay.
They have to test it in another way. But this is something like if you have a Western diet, you eat a lot of sugar, you may have a genetic component, which is this is something that is happening in your body, and you're not going to see the manifestations of that until late. So in these cases, yes, making sure that you have micronutrients. Like, remember, we haven't even talked about antioxidants, you know, because if you have a low antioxidant status in your body, you don't eat a lot of vegetables and fruit, then you're going to have more oxidization of your body. So then you're going to possibly have those endothelial injuries where, and that might not manifest as anything. And then later on you have, depending on where the injury is, then you start to have these ischemic events where you have restricted blood flow, or those plaques rip apart and they form clots, and then you have a stroke, or you have a heart attack, or you have, you know, so these are things that, yes, I would say in terms of prevention, having those micronutrients sorted is really important. Once you are manifesting or you are diagnosed with something, there is still a role to play for these nutrients. So, but you need to more so be working with your doctor. You may need to be on medicine, allopathic medicine, but I would still say, you know, if you have low vitamin D status, your cardiovascular risk goes up, your diabetes risk goes up. So if you are not getting those micronutrients corrected, you're just you're putting yourself more at risk to further developing the disease or getting complications from the disease. Does that make sense?
It does.
Yeah. But these chronic diseases, and I think this is where, if you start to think about, it's hard, you know, when I was 20 years old, I didn't care about the ramifications necessarily.
I don't think most do.
Yeah. So
it's later in life when you start getting those nigs and pains.
Yeah.
And then realize this is not how, like, what normal is. This is not normal, or what I always thought. And I think that even the younger generation, people tend to drink. And, you know, when you have an excess amount of alcohol in your body, and then the next day you feel off, but you repeat that cycle over and over, you never understand what your body should actually, how it should properly be functioning, but how it should actually feel.
Yeah.
You know, and even when you incorporate training into it, it's like, okay, utilizing your body as much as you can, but, you know, the first time that they come in, they're sore. So that's from like a muscular standpoint, but everything else that you're putting into your body is fueling and feeding it. And are we feeling the repercussions right now, or are we feeling it 10, 15 years later?
Totally.
And most of us are very narrow-minded, or short-term, goal-oriented, rather than the long-term, or kind of looking at from a future perspective. And so I think this is where we just need to kind of change our mentality towards it, and continue to, you know, advocate for people of it. This is a longevity, we're living longer in our lives, but living longer doesn't necessarily mean we're living healthier lives longer.
Yes, exactly.
Or just our body status is still here, but mentally and physically, are we still at the capacity that we should be at?
Totally. And I mean, even with the ranges that we see, you know, you might have a test done and your doctor's like, well, you're within range, it's fine. But you really need to be, like, you want to be in the upper end of those ranges for health. And even with the RDIs, you know, a lot of the RDIs are still based around, you know, if you meet this, you're not going to get scurvy. If you meet this, you're not going to get rickets. Well, I don't want to wait to get, you know, like, you'll feel really shitty a long time before you get scurvy, you know, and not be functioning at a high, you won't have the quality of life. And so you want to, and it's hard, and I get it. I mean, I'm now at an age where it does really matter to me, and I do see the impact of what I did when I was 20.
Mm-hmm.
And so I think making sure that you're informed, and also feeling, generally kind of yucky, we get used, that becomes our normal, and
Yeah.
we think it's normal that I'm tired all the time. And especially these ladies that are like moms, professionals, they're like, yeah, well, this is my life. It's kind of like this martyring. I just kind of keep strong, carry on, whatever.
Mm-hmm.
But actually, that's not normal.
Yeah.
And you're functioning, but eventually you might, at the worst, again, get very sick. But also you're missing out on what it means to feel really good.
Yeah. And I think sleep is a big one.
Sleep's massive.
And that people think they can always make sleep up, when in reality you never get sleep back. You could sleep 2 hours last night, 3 hours, and think that sleeping 6 the next day is better than no. Is it better? Yeah, but you're never going to recoup from only those 2 hours that you had.
Totally. And having patience, I mean, those basics, we talked about nutrient status, but I mean, the basics, if you're not sleeping properly, and you're eating not enough, too much, not, and you're highly stressed, those basics will always be relevant for a large portion of the population. So before you even think about going and supplementing and doing all these things, that's the foundation you have to start with, and you can't cheat it. Like you can't game it.
Mm-hmm.
You can't. You just have to do. You have to move. You can't move excessively, but you gotta move if you want to feel good and be healthy. You gotta move, and you gotta have good social support. Like those basic holistic things are pretty important. And then
but people want the short. They want the shortest route possible, and they don't understand that living a healthy lifestyle is a long-term journey that we're going through.
Yeah.
And talking about small diets that people put themselves through, as they're looking at, okay, well, this is going to get me from X to Y in the shortest amount of time.
Yeah. And I get it. I mean, that's the kind of world that's being broadcasted to us as well. It's like, I have this, it's going to make you feel like this in this amount of time. And so we're being hoodwinked. Like we're being tricked into thinking that we can achieve something quickly. And you're totally right. I mean, it is a long-term process, and and it should be something that we incorporate in a way that feels accessible also, and that we can manage, So what I can manage now with my health is maybe different than someone else, I could be doing a lot more, or I could be doing a lot less, and that's just based on where I am in my journey.
But it's taken time for you to get
fully.
Yeah.
It's taken me years to get here.
Yeah.
And I'm still growing, and I still have days where I just want to throw the towel in and say no more.
Mm-hmm.
But you can't borrow time, or you are borrowing time. It's like, if you're not willing to do it now,
mm-hmm.
you will have to do it later.
Yeah.
So you are borrowing time from somewhere. It's like, if you want to, it's the same that I say, if I see people overtraining, it's like, fine, if you want to do it, you are borrowing time later from when you are overtrained and injured,
mm-hmm.
when you can't do it then.
Mm-hmm.
If you want to not take care of your body, if you want to eat shit or not eat enough nutrient-dense foods, fine, but you will borrow time from somewhere else. And there's no gaming it.
Mm-hmm.
You can't, and if you don't want to do it now, fine, but you will have to do it at some point. And maybe later it will be harder. So
start now.
Yeah, like, ask questions. Don't be afraid to get things. Find, if you don't have a good doctor, find another doctor.
Mm-hmm.
You know, and this is me speaking to a population of people who are possibly in a more privileged position that have more choice. And so we need to be able to advocate for ourselves, and build a support team, but also, you know, we have to first have the impetus, like the willingness to be curious about our health in that way, and realize that it isn't when I'm, you know, in like 12 weeks time, then I can just be like, I'm out, like,
yeah.
you know, it's something that my nutritional needs are going to change again in, you know, the time of month, the life stage that I'm at. And we have to realize that, you know, I really feel we have to move away from this, I'm on this X diet.
Yes.
Because there is no one size fits all to anything. That includes nutrients. If your friend is taking, I'm on a high dose of B12 because I have a genetic issue that I can't access enough. I eat it, but I still have to take a dose. If someone else took the dose I'm on, they'd get really sick. So your friends are trying to help you, and they're excited, and we all get excited about our health, and we get excited to share, but we're individuals and we have individual needs, and we have to be really and we have to honor that and really be curious about it. You know, it's like, well, I had someone come into the clinic and they're like, my friend told me, you know, I should take DHEA, and I'm like, but do you know why? No, it's just going to make me feel amazing. And DHEA is, you know, it's a hormone. There's a lot of reasons not to be on it. So you're an individual. You need to treat yourself and honor your own needs.
We're in a trance here. So if you had to give, you know, if there was one thing that you wanted someone to take away from this podcast, what would it be?
Well, I think, you know, look and see what your individual needs are. You know, don't think that more is better in terms of supplements. You know, make sure that if you are going to go onto a supplement, that you need it, and that it is a good quality supplement that is in a dose that's appropriate for you. So understand that you need variety, that you need all of your vitamins and minerals. They're all really important. A deficiency in any of them is going to have a knock-on effect to your health. Full stop. But going in and just buying a whole bunch of supplements and thinking that you're going to correct the issue isn't the way to go. And so think about getting it in your food, and then if you think you have a deficiency, then go talk to someone about it. Yeah. Try to avoid going on the internet and doing Dr. Google search, and go to speak to someone who has an understanding of how that can manifest in your body. Yeah, so it's simple, but it's complex, and we have to respect the nuances of how things work in our bodies, and not just put things in our bodies without knowing where it's come from, what it is, what it's going to do.
And everyone is different.
And everyone is different, totally different. You are not your friend. You process and metabolize things differently. So you need to honor what your own needs are.
All right. A lot of information.
Sorry.
No, I think it's good. I think it gave a lot of context to people. You know, I think that the takeaway, like you said, is, you need to understand that you're individual than everyone else, and the best way is to understand your needs, and to do that is testing and getting that done. And then at least you have an understanding is if you have deficiencies and can you make those up. Obviously, if you're looking at food, taking a variety of food regardless. And then if you can get that through whole food, and if not, then that's where supplements come in.
Yeah, for sure.
Well, thank you for your time. This has been awesome. Yeah, let's do it again.
Cool. Thank
Great.
you so much.